Hi, I'm Sheena Patel, one of the pelvic health physiotherapists at the Great Western Hospital in Swindon. I'm going to talk to you about pelvic girdle pain, which may arise during pregnancy.
Pelvic girdle pain is an umbrella term used to describe pain antenatally and postnatally. These areas include the lower back, the sacroiliac joint, the sacrum, the coccyx, hip pain, pain within the groin and the pubic symphysis area. Pain can also occur at the perineum and the inner thighs. This is a diagram showing all the areas that are affected during pelvic girdle pain. Most musculoskeletal pain will arise due to changes in hormone levels, leading to laxity within the muscles and the ligaments. Pelvic girdle pain can arise as early as 8 weeks within the pregnancy, but this can depend on varying factors, such as previous pregnancy, which you may have had some pelvic girdle pain, history of trauma, the baby's position, and jobs which may entail heavy lifting. But remember, every pregnancy is different. Maternity belts are readily available. If you choose to use a maternity belt during your pregnancy, please ensure it fits well. There is a link after this video to show you how to fit a maternity belt, and it may help you in your choice in buying one. There are a few cautions when using a maternity belt. Please do not wear one when you are sitting down or when you are going to sleep, as it can restrict the blood flow to the baby and can cause other issues. The Great Western Hospital offers its antenatal patients free crutches. Crutches are great as they offload the pelvic joints, allowing the inflammation to become reduced, which in turn will reduce the amount of pain experienced. The crutches will be fitted by a qualified physiotherapist or a physiotherapy assistant. They will be measured to the right height. Please do not adjust these without any professional advice.
Ice and heat are a great form of treatment during antenatal care. Ice and heat have many benefits. Let's go through them. Ice is a natural anti-inflammatory. It can be used during all 3 trimesters and it is completely safe for mother and baby. What we advise is to wrap the ice with a towel to avoid any ice burns. There are lots of benefits of heat also during pregnancy. It's a natural muscle relaxer. It brings lots of blood flow to the injured area, which can help with the healing process. It can help loosen tight muscles, especially around the lower back, and it can help reduce feeling of pain. Heating pads and hot water bottles are readily available. The only caution is, try to prevent direct contact with the bump. So again, wrap the hot water bottle or the hot pack with a towel prior to applying it.
Posture is key when preventing and treating pregnancy-related pain. The increased weight of the bump and muscular changes during pregnancy can lead to adopting an incorrect upright posture, which can lead to pain. To maintain correct posture, lift your head through the crown, keep your chin lifted. Correcting posture will reduce headaches, neck pain. This can be aided by doing some simple neck stretches and strengthening exercises. Draw your shoulders back and down and keep your rib cage up. This will reduce upper back and rib pain in later trimesters. One can stretch shoulders back and strengthen muscles between the shoulder blades to counteract this pain, using TheraBands, which are easily available online or via the rehab shop within the physio department when it is open. Try and contract your abdominal muscles to support the baby. Tuck in your bottom and tilt your pelvic bone in slightly. This will reduce lower back pain and reduce lumbar lordosis, which is a curvature in the spine. Simple pelvic tilting exercises can be very effective in reducing pain and stiffness. Additionally, by tucking your pelvis in, this will help contract your bottom muscles, which are very important during pregnancy. Keeping bottom muscles strong will provide increased support around the pelvis. Weakness of the bottom muscles can lead to tightness within other areas, causing sciatic pain. This is a sharp shooting, throbbing pain down the leg and within the buttock region. Please refer to the link for sciatic pain stretches. Try not to lock your knees out, as this will cause an achy pain during the pregnancy. Keep moving to improve the circulation and prevent leg cramps. This can be done by doing simple but effective calf stretches and range of movement exercises of the knee, the feet and the legs.
Many patients complain of lower back pain, hip pain and groin pain when they sleep. This is completely treatable. What we advise is to apply a maternity pillow underneath the bump side that you're sleeping on and weave it through the legs. Your main aim is to eliminate the ski slope bump that will occur when you sleep on your side. This is to allow the muscles to rest when sleeping. You can also apply a pillow behind your back, and this is to prevent you from rolling over in your sleep.
Pelvic floor exercises are paramount. They should be done routinely. This is a diagram of your pelvic floor. The pelvic floor works like a hammock, encasing the urethra, the vagina, and the rectum. We give the following instructions to our patients to activate the pelvic floor. Pull in your back passage. You may also feel an upwards and forwards movement whilst contracting the pelvic floor, depending on how strong you currently are. Try not to hold your breath or clench your buttocks or your thighs. If you are doing it correctly, nobody else should be able to notice that you are doing your pelvic floor exercises. We normally say, try to squeeze your pelvic floor up to 10 seconds, completing 10 squeezes each time. NICE guidelines suggest that we do our exercises 3 times a day, completing 10 repetitions with up to 8 to 10 second holds. We recommend that you practice your pelvic floor exercises postnatally and antenatally and find how long you can hold for and work from there. The NHS have access to the Squeezy app. This is a pelvic floor application that we recommend to help you do your exercises and motivate you along your path. There are many ways of coping with pelvic pain during pregnancy. The Association for Chartered Physiotherapists in Women's Health, otherwise known as the POGP, offers the following advice. Be as active as possible within your pain limits. Rest when you can. Pace your activities throughout the day. Get some help with your household chores from your partner, friends, family, wherever you can. Wear flat, supportive and comfortable shoes. Sit down when you're getting dressed, as one-legged activities can often cause pain. When getting in and out of the car, be very careful. One can apply a plastic sheet on the seat and pop your legs together and swivel round before you get out of the car. You can apply the same technique when getting back into the car. This is to avoid any activities which may aggravate the pelvic girdle by separating the legs. Sleep in a comfortable position using maternity pillows. Try different ways of turning in bed, which seems to be quite the problem for pregnant individuals. I advise to think of it like a 3-point turn when you're driving. So if you're lying on your left-hand side, pop your legs together, squeeze your buttocks really tightly and turn a little bit. Relax your bottom muscles, squeeze again and turn your legs again, and keep going with that advice until you get into a comfortable position for you. The key is to use your bum muscles to support the pelvis to prevent any pain when turning in bed. When taking the stairs, you can either go up the stairs one step at a time, or you can go upwards on your bottom. If you're using crutches, have a small backpack that you can put things in when you're walking around. This will make your life a lot easier. When having sex, think of different positions, such as kneeling or using an all-fours position. This is to take the pressure off your pelvic joints and prevent any overloading, which may cause pain during or after. In the PowerPoint, there are some exercises that we have put together, as we know that they will help relieve your pelvic girdle pain. Please have a look and give them a try. There are some red flags that we'd like you to be aware of. So, if you get any recurrent headaches, any floaters in your vision, so these are little black dots that go across your eyesight, experience any vaginal bleeding, or have reduced movements during the day or the night, which is different for you, please contact the Day Assessment Unit or the Birthing Centre. The telephone numbers are on your yellow book. If you have any queries or questions regarding any of the advice, information or exercises given in this presentation, please contact the physiotherapy department at the Great Western Hospital, and we will be happy to deal with any of your queries. Thank you for listening.